The two most common ways to define the cranial nerves are either by classifying them according to their developmental functions, sensory, motor, or mixed, or by their anatomical numbering, which ranges from 1 to 12 and reflects their successive origins from caudal to ventral part of the brain and brainstem. Cranial nerve 1, olfactory nerve. The olfactory mucosa houses the afferent bipolar sensory neurons. The olfactory nerve is made up of these neurons arranged in nerve bundles called filia olfactoria. The olfactory bulb, located in the anterior cranial fossa, is where the nerve fibers synapse after entering the cribriform plate of the ethmoid bone. It functions for smell or detection of odors. Cranial nerve 2, optic nerve. The rods and cones of retinal sensory receptors send visual information to the thalamus, mainly the superior colliculus and the lateral geniculate nucleus via the optic nerve. The optic nerve fibers travel via the optic canal and enter the middle cranial fossa. It functions for vision. Cranial nerves 3, 4, and 6, which are the oculomotor, trochlear, and abducens nerves, respectively, innervates the extraocular muscles. These nerves enter the orbit through the superior orbital fissure. The trochlear nerve innervates the superior oblique, which is for intorsion, depression, and abduction eye movement. The abducens nerve innervates the lateral rectus muscle, which is for abduction. The oculomotor nerve innervates the rest, the inferior oblique, the skeletal muscle component of the levator palpebrae superioris, and the remaining 3 rectus muscles. The Ettinger-Westphal nucleus, or the visceral oculomotor nucleus, is the source of its general visceral efferent component, plays a role in regulating pupil constriction and lens accommodation, ultimately controlling the iris sphincter and ciliary muscle. To remember easily, SO4 and LR6. SO4 for superior oblique, cranial nerve 4, and LR6 for lateral rectus. Cranial nerve 6, it functions for eye movement, pupil control, eyelid elevation. Cranial nerve 5, trigeminal nerve. This nerve is both sensory and motor. The sensory innervation of the face is provided by cranial nerve 5, which has 3 major branches: V1 ophthalmic, V2 maxillary, and V3 mandibular. Furthermore, the muscles of mastication, the anterior belly of the digastric muscle, the mylohyoid, and 2 small tensor muscles, the tensor veli palatine and the tensor tympani, receive motor innervation from its V3 branch. It functions as both sensory and motor muscles of mastication to the face. Cranial nerve 7, facial nerve. This nerve is both sensory and motor. The stylomastoid foramen is where the fibers leave the skull after innervating the facial expression muscles, allowing actions like smiling, frowning, raising eyebrows, and closing the eyes. It also carries taste sensation from the anterior 2/3 of the tongue. It functions for facial expression, eyelid, and lips closure. Taste in the anterior 2/3 of the tongue. Cranial nerve 8, vestibule cochlear nerve. This is a motor nerve in charge of vestibular and auditory perceptions, associated with head orientation. The cochlear duct, semicircular canals, utricle, and saculaus the sensory receptor cells called hair cells, which converts mechanical stimuli into electrochemical signal and send it centrally via the internal auditory meatus. It functions for hearing, balance, and equilibrium. Cranial nerve 9, glossopharyngeal nerve. This is a mixed motor and sensory nerve. The sensory part receives information, including taste, from the posterior 1/3 of the tongue, the pharynx, and the carotid body and sinus. The motor part controls the stylopharyngis muscle, which elevates the larynx and expands the pharynx during swallowing. It also innervates the parotid gland, which is responsible for salivation. It functions for taste, perception, and swallowing. Cranial nerve 10, vagus nerve. This is a mixed motor and sensory nerve and is the longest cranial nerve. It is the primary nerve of the parasympathetic nervous system, responsible for functions like digestion, heart rate, breathing, and mood. The motor part innervates the muscles of the palate, pharynx and larynx through the nucleus ambiguous. The sensory function carries information from the pharynx, larynx, thoracic and abdominal viscera, and taste buds at the root of the tongue. It functions for multiple bodily functions such as speech, digestion, respiration, cardiac activity, and possibly the immune system. Cranial nerve 11, spinal accessory. This is a motor nerve that innervates the sternocleidomastoid and trapezius muscles, together with cranial nerves 9 and 10. These fibers leave the cranial cavity by the jugular foramen. It functions for head, neck, shoulder movement. Cranial nerve 12, hypoglossal nerve. This is a motor nerve. The tongue's intrinsic and extrinsic muscles, with the exception of the palatoglossus muscle, receive innervation from cranial nerve 12. It provides innervation to the muscles of the genioglossus, genioid, huglossus, and styloglossus. Its fibers leave the cranium through the hypoglossal canal. It functions for tongue movement and speech articulation. In summary, we have the mnemonic O, to touch and feel very good velvet. Ah, heaven, to remember whether it's sensory, motor, or mixed. Remember this mnemonic. Some say marry money, but my brother says big brains matter more. Thank you for watching. Hope this lecture helps you. See you on the next video.